Andy Gill reporting there. Well, Dr. Zubaida Haque is a member of Independent SAGE, a group of scientists who are working together to provide independent scientific advice to the government. Dr. Haque, thank you very much for joining us. How concerned are you about these variants, the Indian variant of concern in particular, given the fact that we do have the vaccine now?
Well, Independent SAGE are very concerned. I mean, we've been concerned for quite some time, and we were really quite surprised that last Monday, when the Prime Minister announced that everything was fine and the data to go ahead for the roadmap next Monday on May the 17th, we were concerned that actually, while the Prime Minister was saying that we passed all the tests, actually it wasn't entirely truthful to say that we'd passed all four, because we haven't passed the test necessarily around the risk of variants of concern. And we've seen with this variant, the B16172, so-called Indian variant, it is rapidly increasing across the country. We know it's particularly prevalent in the northwest and in London, but it is slowly spreading. And in the areas where it's spread quite a lot, it has quickly become the dominant variant. And that means it's a real concern. It's also been designated as a variant of concern, which means that it's likely to be as transmissible, if not more. There is some evidence to suggest that it may be 60% more transmissible than the Kent variant that caused our second wave last year. So there are real concerns about it, and there are some concerns, although tentative at the moment, that it may even evade some of our vaccines. But we should wait and see. Vaccines are still effective, and it's great that the government are sending more vaccinations to places like Bolton at the moment.
How wise is it then that, say, the changes that are due to come into place next Monday, that's 17th of May in England, which so many people are hanging their hopes on, does the data support those changes?
Well, it's difficult because some of the data does. And of course, it's been an extremely long time in lockdown. We've been in lockdown for several months, and that's had a real mental health toll on many of us. Some of the data does, in terms of the fact that, of course, you know, if you look across the country, cases are coming down. Deaths are now in double digits, which is tremendous. It's great that deaths are coming down all the time. But the problem is just as the roadmap tests show us, that's not the only concern. This is the year of variants. And what I mean by that is variants, if we don't watch them, if we don't keep them under control, like the B16172 Indian variant, as well as the South African variant, if we don't keep those under control, they could really undermine the success of the vaccination program. And we've seen the devastation that the so-called Indian variant has caused in India, you know, with over 400,000 cases per day, millions and millions of deaths. It has been absolutely devastating. And we cannot return to the hospitalization rates like we did in January. We're unlikely to return to the death rates, which is really good news, and that's, you know, testimony of the vaccination rollout. But most of the population are only partially vaccinated, you know, and there's quite a significant part of the population that aren't vaccinated at all.
Dr. Haque, let me ask you one final question. If you could answer it briefly, I'd be very grateful. How likely is it then that regional or local lockdowns would be sufficient, in your view, rather than a nationwide one? Just briefly.
We don't want a regional lockdown, neither do we want a nationwide one. What we need is for government to pour resources to the areas that have been significantly affected by the so-called Indian variant right now, and send vaccinations there. But that's not enough. They need to reform the test trace system, which has not been fit for purpose. They need to support isolation, including in multi-generational housing, where they need to provide more finance and accommodation. They will need to do that in a lot of the areas affected, because they are much more disadvantaged areas and have lots of overcrowded housing.
Dr. Zubaida Haque from Independent SAGE, group of scientists, thank you very much for your time.